Hi everyone and welcome back to my channel. In this video today we will be talking about how Pilates can help your erectile dysfunction. We will be sharing with you some exercises that you can do to help your symptoms. I'm Anna Maria, I'm a physiotherapist and Pilates instructor, and I will be joined today by male and female pelvic health specialist physiotherapist Mr. Bill Taylor. Thank you for joining me, Bill.
Hi Anna Maria, thanks for having me along.
So as you know, I teach a lot of Pilates and I was very intrigued to find out how Pilates can help males with erectile dysfunction, because we all know how it helps low back pain, neck and all the other conditions, but it's one of the things that we really don't talk about when it comes to Pilates and erectile dysfunction. So before we begin, I thought maybe you can share with us, with the viewers, some of the things that most commonly people come to you, physical symptoms or non-physical symptoms, those who suffer from erectile dysfunction.
Sure, I think obviously the biggest problem is sexual dysfunction, is inability to achieve an erection that is sufficiently useful to be pleasurable and maybe achieve orgasm with yourself or with your partner. And then within that erectile dysfunction remit, there's conditions called hard flaccid or premature ejaculation, or pain with ejaculation. So there's a few different complicated things that are out there, but ultimately the common theme that's running through them is pelvic floor muscle dysfunction. Right,
yes, so that makes a lot of sense, and I know that it's stigma primarily, but it's a lot of the problem is that we don't really talk a lot about symptoms and these conditions as well. So I thought maybe we could also share just a little bit some of the misconceptions. So one of the things is a lot of people will say that this happens to you when you're older, when in actual fact there's at least 50% of males get erectile dysfunction between the ages of 40 to 70. Would you say you agree with that? And maybe are there any other misconceptions we can go through?
I think I would agree with it. And I think, so I've been a pelvic health physio for 20 years. I've been treating men for the whole of that time. I think there's been a definite increase in erectile dysfunction post-COVID. And I think there's lots of different reasons for that. The science and the evidence for that at the moment really seems to be lying in the realm of pornography, and the fact that people were isolated and stuck in their houses and they had nothing else to do, so they started looking a lot at porn, on online porn, and a bit bored, so became a little addicted to it. And I use that word in the loose term, not necessarily in the kind of scientific definition of the word, but they became a bit stuck on it, really. So absolutely, most of my patients are quite young. I have three groups. I have a group of probably 25 and unders. I have a kind of a middle group of guys who, for lots of different reasons, have erectile dysfunction because of chronic pelvic pain, because of trauma, maybe because of recurrent infections. And then I have a third group, we're getting younger every year, who are post-prostatectomy, radical prostatectomy patients who've had their prostates removed because of prostate cancer. And they are coming to see me because they often have erectile dysfunction after their surgery. But that age group used to be considered 70, 80, but now it's more like 40 and 50. So absolutely, I think right across the board, it's happening to younger people, and it's also happening more often.
Let's delve into a little bit more about how Pilates can help erectile dysfunction. So I did a little bit of research and I came across, obviously the most research is around the fact that aerobic type of exercise will help improve symptoms with erectile dysfunction. Now we know Pilates is not exactly aerobic, but it can be at certain classes. In itself it's not, but these are the few things that I found that can be beneficial after doing Pilates for improving symptoms with erectile dysfunction. So in general, Pilates has been shown to improve circulation, especially around the pelvis area, reducing stress and promoting overall well-being. But I would like to just say this, specific research on the direct effect of Pilates and its impact on erectile dysfunction does not really exist. So it is more a holistic approach to Pilates and erectile dysfunction than it is to directly linking Pilates to erectile dysfunction. What's your take on this?
So I think I agree with that. I mean, I think the primary intervention for erectile dysfunction is lifestyle change. So reduce alcohol intake, stop smoking, increase your activity levels, whether that be strength conditioning or Pilates or aerobic exercise. Get some decent sleep, reduce your stress. So all of those things really play into it. It's multifactorial, so there's not one thing. If you just go and lift weights, or if you just go and do Pilates, or even if you just go and do aerobic activity, absolutely those things all together will help. I think the problem is that there's kind of a heterogeneity with erectile dysfunction. We take all of the different things that can happen and we put them under one heading. And so the problem is that there's no panacea, there's no one thing that fixes everybody, and everybody's very individual. The thing about exercise is there's no best exercise for everyone. The best exercise is the exercise that someone will do. So if you have a patient who absolutely loves Pilates, then you encourage them to do that, and they have erectile dysfunction. You can encourage them to do Pilates, but you can nuance or focus or identify exercises that might have more of a beneficial effect to facilitate function in the pelvic floor and to make the muscles work a bit better. The thing I'd quite like to say is that men's pelvic floors and women's pelvic floors are at one and the same time the same and different. And the way that the muscles work and the way the muscles are cued and facilitate are at the same time the same and different. So today what we can kind of impart is that there has been some research done using visual and dynamic ultrasound, looking at how which cues work better for the anterior pelvic floor, which is more connected to the function during erection. And Kegels are the exercise that everybody knows for the pelvic floor, and they're kind of if you like, they kind of hide away in a lot of Pilates exercises. And Pilates often, in my experience over the last 20, 30 years of doing Pilates and knowing about Pilates, the way that pelvic floors are cued, the way that breathing is cued, the way that Pilates is taught really has changed. So, or even is still changing. Maybe it hasn't changed and it's static, it's quite dynamic. And I think, I'm hoping that these exercises and what we tell you today are an opportunity for you to modify and focus some of your cueing strategies and some of the exercises that you prescribe to patients that might help a little bit more than some other exercises. I would say though, there is no absolute cure-all exercise. Let's think about men's pelvic floors a little bit differently from women's pelvic floors, because they kind of are.
100%. Okay, so despite the limited research that there is, with the amount of experience that Bill has and my experience in Pilates, we have come up together with the following exercise that we're going to share with you just now and how these can help you. And we're also going to be sharing a little bit about how to, as a Pilates instructor, help cueing either on a one-to-one basis or in a class, in a classroom setting, that will help you as a Pilates instructor get the best benefit through your Pilates classes. So just stick around and we'll go through these exercises. So this bit is going to be about going through the Pilates based exercises. So I thought we would go a few exercises starting with spinal mobility and then focusing on lateral breathing and breathing techniques. We're going to be changing position, and Bill is going to be sharing with us a few cueing tips and just refining a little bit the techniques when it comes to, as a Pilates instructor, but also if you're doing it on your own, you know a little bit more of what you should be feeling and the movement that should be happening. So we're going to start off on all fours. So we're going to do it on a plinth, but you can do this on the floor, on a carpet. Just make sure you have a nice safe space as always, and take your time and don't rush any of the exercises. So with this one, just pop onto your hands and knees. So we're going to do what we call the thread the needle in Pilates. The thread the needle is focusing mostly on getting thoracic mobility and getting that rotation. So what you do is you'll be on your hands and knees. Make sure knees are underneath your hips and hands underneath your shoulders. Equal weight on both hands and knees. And then we're going to slide. This side is your right hand. And you're going to take a breath in and then slide as you breathe out slowly, rotating that chest. Focusing on keeping your hips pointing down and rotating through the chest. And then we're reaching up towards the ceiling with that arm. And then again you go down, reaching through towards the opposite side. And then rotate all the way back up. very important not to hold your breath throughout the movement, so just breathe in and out and allow that movement to happen. So with this one, Bill, would you say there's any particular cueing when it comes to your pelvic floor here?
I think the secret is just to not hold your breath, exactly what you said. Stay moving, keep it fluid, breathe, reach. The guys sometimes have a bit of a tendency to clench the pelvic floor. So perhaps sometimes at the beginning you might say breathe in, breathe out, let your pelvic floor relax, maybe let your tummy sink a little bit, find easy neutral in a way, go up to the top, come down to the bottom and say, where does that feel comfortable for you? There's no kind of correct posture to begin, so find where you feel comfortable. Breathe in, breathe out. How does that feel? Ask them if they feel their pelvic floor is overworking or tightening when they do the exercise, because you don't want them to be holding the breath or gripping. And the other thing they tend to do, which is kind of sneaky, when they want to grip, is they grip by externally rotating their shoulders and adducting them to get a whole kind of tension across the whole back. So I think you want to just make sure they're not doing that. And also the other thing I think is they might do one or two of them well and then kind of sink back into old habits. So you have to keep observing.
Okay, so that was your thread needle. So from here, then we're going to take a little bit of a stretch into a child's pose. So kick your feet together, open your knees a little bit wider, as wide as your mat, or in this case it's a plinth. And I want you to just sink back through those hips as you breathe out. Thinking of pushing that tailbone away and really just lengthening through your top part of your chest and just dropping your tummy down, letting everything on the front relax completely. With every breath out, it's just important to get that exhale out and relaxation through all your pelvic floor and everything on the front. So again, what cueing would you suggest here?
I think the breath is really important. And then I think the idea of when you're in this position, once you get here, sending your coccyx away to the bottom of the bed, sending your sacrum,
just sending this, lengthening
through your spine, and trying to feel a separation. Almost, and I think sometimes as well, if you're a bit stuck in the thoracic spine in this position, you can kind of let your chest sink. So breathe in, breathe out, and when you breathe out, let your chest sink down and your chin and your forehead ends up on the mat. Trying to keep your legs together, and you can push back a little bit through your arms as well, so you do a little bit of a passive stretch into that child pose. When you get there, take a breath in, breathe out, then try to relax into that posture.
Very good. So again, it's all about trying the relaxation part of it, to let go rather than brace all the time.
Absolutely.
Which is more, it's important for especially pelvic floor stretching, which is really good. Apart this being a mobility exercise, it's all about stretching also in the muscles around the pelvis and the coccyx and the sacrum.
Yeah. This is my favorite exercise.
It's a very good one to get a bit of disassociation between your sacrum, your lumbar spine, especially if you also have a little bit of a stiff lower back, which also can be the case as well. So again, you're gonna need to be nice and comfortable in a supine position, we call it. So you are lying on your back. Knees bent, feet on the floor, toes pointing forwards. So in this case, I'm just going to shift so you can see the toes. You want to try and be a nice straight line. So as we always say in Pilates, you want to try and keep your toes in line with your knees, in line with your hips and shoulders. And you're going to think of your head, neck and spine lying right in the center of it all. So if you're lying on the mat, you'll have your arms a little bit more supported. So it's a bit easier to do as well than onto a plinth like here, because we're limited with space here. But also just make sure you're in a straight line. There we go. So with pelvic floor, we're going to think of pressing that lower back, but we've had a discussion before doing this with Bill, and he suggested doing a little bit more segmentalization. So really thinking, actually starting from the coccyx, from the then to the sacrum, then to the lower back.
As guys, we need as much help as we can when it comes to movement. So I kind of go back a little bit to some breathing and do lateral costal breathing. So the very first thing I teach them is take a breath in wide and full to your lungs. So fill your lungs out into your ribs rather, and fill your lungs up underneath your hands, and then breathe out. So you want to breathe in through your nose. You want to breathe out through your mouth. So they get used to that breathing, so that becomes a pattern that is their standard practice breathing. So whenever we go back to any kind of breathing for cueing, that's the breathing. If I want them to use breathing as part of the exercise, that's the breathing they'll do. Then the next thing I'll do, nice and relaxed, take a breath in, and when they breathe out, they send their coccyx away. So they don't move the sacrum, they don't move the lumbar spine, and then they let go, and then let your coccyx relax back onto the bed. So I'll say to them, they might not understand this, they might think it's really difficult for them to grasp, but I say, don't worry about not moving, just think about moving. So take a breath in, breathe out, send your coccyx away. So basically it's a very small lengthening. It's a little bit of tucking your tail underneath without tucking your sacrum and your lumbar spine.
So when we're talking about coccyx, sacrum and lumbar spine, just for people to understand, the coccyx is the really last bit of our spine. Then there's a bit of the sacrum, which is a solid more bit, and then it comes onto our lower part of our lumbar spine, which is our lower back, essentially.
And I think sometimes it's like a dog's tail, and so oftentimes what happens is the tail is wagging the dog, and so we need to change it around a bit so that the dog can actually wag its tail again. So you take it up to the next level where you take a breath in, you breathe out, you send your coccyx away, then your sacrum, right, and roll back onto your first lumbar vertebra and let go. And what you should feel is they're working quite hard to make this happen. And then relax back, so your coccyx goes down and your your sacrum extends, or what we'd say is counter-nutates.
Yeah.
So counter-nutate is just the movement where your sacrum rotates forward in the sagittal plane. So that's the plane that goes from the front to the back of your body. So breathe in, breathe out, send your coccyx away, flex your sacrum, and keep going this time and flex your L5. Now, that's quite hard for me because I'm quite stiff there. Then I come back down, let my L5 extend, let my sacrum extend, let my coccyx extend, breathe out, relax, breathe in again, and do that combined movement, coccyx, sacrum, L5.
So really just breaking down what we know as pelvic rocks
L5.
in Pilates, which is fairly easy for most people, but there's quite a lot of people who find this difficult to begin with.
Most guys, I would say, if they have erectile dysfunction or pelvic floor dysfunction, they tend to walk about with their pelvic floor switched on all the time. So if I have a switched on pelvic floor, when I try to do a pelvic rock and lift my pelvis off the ground, what I get is this.
So like a flat
it
kind
goes
of
really,
lift.
instead of that, and lift, and then down, and then let go with the rotation, I get that. And it's quite hard. They sometimes get cramp in their hamstrings, they get cramp in their feet because they're having to work so hard. They're gripping with their feet because they're not using their pelvic floor to stabilize their hips and to create that flexion moment about the pelvis to get them to curl up. And in actual fact, if you think about this is the kind of movement that you would actually functionally use when you want to use your pelvic floor, when you want to use your erections. So this functional tilting, this thrusting movement is the movement you want. Now obviously, when you have sex, I think the other thing about this is when you have sex, the movements are much more functional. This probably a lot faster from time to time and involve acceleration, deceleration and change of direction. So this is obviously just in one
movement, one plane.
So you can be creative with this, and as people get better, you can make it whatever you think you can make it to be to make them functionally more useful.
Yeah, makes sense. Okay, so let's switch a little bit into lateral breathing in a different position. So we did lateral breathing on the side, and I know you mentioned you like doing this in a more functional position. So I don't think there's an actual name for this one in Pilates, but it is kind of like a side bend mermaid on the side, focusing on lateral breathing. So I'll let you explain this a bit further, Ben.
So I think, again, let's say the guys aren't getting lateral costal breathing supine, and sometimes they don't. Sometimes they often have been practicing diaphragmatic breathing for quite a while, so they have an overactive diaphragm. So one of the ways, if we do something novel, if we give them something different, it makes their brain think a bit harder, it makes them focus on something different. So you take your hand, you put it on the side of your rib with your elbow pointing up to the ceiling, put your knees together nice and comfortably, support your head. If you want to have a block under here, that's fine. Sometimes putting your head down is a little bit too uncomfortable, so you can put a block. Then what you do is take a deep breath in, and then breathe out. And breathe in, and then breathe out.
So you can have
You can put a little pillow in here.
pillow or
Absolutely.
something underneath,
To
just
support
make
that.
it relax.
Breathe in. Now breathe out. My pet thing about breathing is making sure that when you breathe out as far as you can. So you empty your lungs as much as you can, all the way, because it means that breathing in is easier.
And there's also like a stretch release kind of
So you
effect
can
that happens.
yeah, and you can really get this, and when you let go, it means that your lungs will fill up automatically. And if you think about it, the thing about the pelvic floor is it works automatically in the background without volitional connection. When you're rehabbing or rehabilitating erectile dysfunction, you're making that volitional connection much more in the moment and much more conscious. And what you really want to do is get back to unconscious connection. So the next thing I do is straighten your leg. You want to add different things in. Take your arm up above your head. So you end up in almost like a kind of a dying swan position. It's like the final scene from Swan Lake. Not that I was ever a dancer. So you take a breath in, breathe out, stretch your legs, stretch your feet.
So it's almost like a stretch also for your QL.
It's QL, it's lumbar spine, it's so breathe in. And then breathe out. Good. Okay.
Right.
And I think Anna Maria was going to show me how to do a mermaid, because I think mermaid is very similar to that, but a little bit of a progression.
Yes, so mermaid is having your, this is your left side, so slide your left leg forward. You're going to bring your left foot next to your right knee. And you want to try and keep your pelvis through the back. So we're limited with space here, but if you want to think about, so the key thing here is, again, we're going to try to stretch the side of your waist. So again, we're doing like a QL stretch. You want to try and anchor that right hip down as you lengthen and lift the right hand up and over, but you can use this hand if you need to for support.
Yeah.
Again, if you want to add more stretch, lower this down onto the elbow, and that will give you a bit more stretch, but you want to make sure that you're not lifting through that right hip. So if you feel like you don't have that movement, you can stay up and you just lengthen away. So lengthen fingertips away from your chest, and you're sinking that right hip right down, and you're really just focusing on this bit here. So ribs coming away from your hips, basically. And again, you can do lateral breathing, aiming from that side of your chest and opening the side of your waist. And ideally do it on both sides, as always. Would you say?
Yeah, I like that.
Would you say both sides?
Yeah, I would say both sides, yeah, definitely.
Both sides.
Yeah.
So those are more mobility and lateral breathing exercises. So the final bit is focusing on pelvic floor. So
many years, Kegels were the exercises that everyone threw around for pelvic floor, and I think there's really, really good level evidence that Kegels are very effective for improving pelvic floor muscle function. It makes a difference. We know it does. That's what the science says. And what happened was that Kegels were applied to men's pelvic floors with equanimity, as if that was just absolutely the right thing to do. And what we've discovered is that in actual fact, men's pelvic floors work slightly differently. We have a longer urethra and we have to close it down in a slightly different way. The other thing that happens is the muscles that are involved in erectile function and ejaculation tend to sit more at the front of the pelvic floor rather than the back. So what we need to do is we need to change the cueing. Now the nice thing for us is there was a very famous paper by a couple of Australians who looked at imaging the pelvic floor when trying different cues, and they discovered a few different cues that work much better for connecting the muscles at the front of a man's pelvic floor that really help with erectile function. So what the kind of traditional thing is to sit on your sitting bones, and again, because by this point the guys often have got the breathing sorted a little bit, they're a bit connected with it, so I want them to breathe in, but I want them to breathe here. I don't want them to do an apical breath, although to be honest, initially if that is their pattern, I'm happy to go with that because there's no right or wrong, just whatever he can manage to do. So he would take a deep breath in, he would breathe out, and as he breathed out he would slide his sitting bones together and he would close his rectal sphincter a little bit. and let go. And that would fire up your the muscles that run from the front to back of your pelvic floor and the ones that run across the side at the back of your pelvic floor. So looking at the middle and the back a little bit more. You obviously get the whole thing working, but it's just altering the nuance or the bias towards it. Then the second thing is in this position to take a breath in, to breathe out, and then to lift your testicles up towards your tummy. And that pulls in the muscles at the front, bulbospongiosis and ischiocavernosus specifically. And then the third thing you can do is you can take your penis itself and you can kind of draw it into your abdomen. So you pull it back almost as if there's a thread going in through your belly button that shortens your penis and pulls it into your abdomen. A bit like a turtle's head or a tortoise going back into its shell. And you can add them in really, really easily with breath. Breathe in. Breathe out, slide your sitting bones, and then let go. Now for me, the letting go is as important as the contracting because that allows the muscles not to become overactive and it allows them to relax in between times. So breathe in, breathe out, and then lift out your testicles and let go. Then breathe in, breathe out, and then shorten your penis. And those are 3 different separate exercises that you can add together in various combinations. So let's say people have been doing it for a while and they're getting pretty strong. You breathe in, you breathe out, slide your sitting bones, lift your testicles, shorten your penis. So there's 1, 2, 3 levels getting harder and harder and harder. The thing about strengthening these muscles is you want them to contract as hard as you can possibly make them so that it's the maximum contraction you go for. But to begin with, that can either be really difficult for guys to connect with, or if people have pelvic floors that are not relaxing, that can sometimes be a bit negative and you might not want to do that. So I think what you do is everyone's different. There's evidence that these muscles work better and strengthen quicker if you're sitting or if you're standing. And the research to look at that was really done in post-prostatectomy people. So especially if you're post-surgery, then standing or sitting can be more useful. I think when you think about sex, it's very functional, and sex is not sitting on a bench squeezing your pelvic floor. It's lying on your tummy, so you can put people in prone, or it's on your knees, or it's standing up. So you have to consider the functional positions. So if guys are if you have a class that you're making them stronger and they've come for a few weeks, and you may be at week 6 or 7, it's at that point where you're thinking, I want to get them standing up, I want to get them moving around, I want to get including compound movements like hip flexion and extension into their pelvic floor. And there's lots of different ways in Pilates to do that. So as long as you've covered the basics and they're able to recruit the pelvic floor, they have a connection with the pelvic floor, they're not breath holding, and they're not bearing down. And I'm not going to say that that's bad, because at times you might want to breath hold, you might want to bear down, you might want to do all of those things for sexual function. So it's about trying to, sex is a bit like a marathon, and it's a bit like learning to run. So if you've started running, you're not going to run a marathon straight away. You're going to run a couch to 5k, or maybe you'll go and do some sprints up the park, but you're not going to go run 26 miles. So I think we think of sex as a functional exercise that includes lots of demands on the pelvic floor muscles. Because remember, the pelvic floor muscles control our hips, help control the lumbar spine, help hold our organs in place. So there's lots of demands placed on it when we're using it, and this is us working it in isolation, so it doesn't just go from here often to being functional in the bedroom.
Similarly to if you have to train quads in your gym.
Anything. So
similar muscles as anywhere else.
We spoke about this earlier, and I don't think the pelvic floor muscles are magic or fancy or have any magical qualities. They just need to be treated like and trained like normal skeletal muscle.
Exactly.
For sure.
And would you say, just one quick thing before we finish off, would you say if you're sitting, would your feet need to be ideally supported? So we have
a bench. So I think absolutely. As soon as you fix my feet on the ground,
more activation.
It's more activation and it's easier. So that's closed kinetic chain.
Yeah.
So if I take the bench away and now we have open kinetic chain, I then have to work much more on stability. So it might well be if people are having a hard time to get the exercise or maybe they're not really improving, then what you want to do, it's like not working them too hard. It's like if you were doing an exercise standing up, you might be on a really solid piece of ground as opposed to standing on a cushion or kneeling on a Swiss ball. If I'm sitting dangling, pardon the pun, there's an instability, there's a perturbation brought into the whole exercise that is different from if my feet are planted, where I suddenly I have a connection to the ground, and that allows the hip muscles to work as more as stabilizers, which means the pelvic floor muscles can work more as pelvic floor muscles. So you have to consider those things, and it's all the things that you would normally consider in Pilates when you were prescribing or progressing exercises.
I agree. Would you say doing it on a mat, obviously chair is ideal if you're going to do a class, but would you say sitting down cross-legged on the floor not ideal to do the exercise?
It's not ideal, but I think so. I think you're better to be doing the exercises than not.
Yes.
So I would have them anywhere rather than nowhere.
Yeah.
And I think sometimes if you get buy-in from a client who's doing the exercises and feels some benefit, getting them to be in different positions wouldn't be that hard. And if people have problems with standing, or if they have problems getting into positions that you want them, feel free to modify those, and don't think this is set in stone that you have to do. Like I say, the science is out there that says sitting and standing are better, so we know that makes it more efficient, but it doesn't mean to say that the muscles won't strengthen in other positions.
Agreed. Okay, so just to recap, we've done some mobility exercises, some lateral breathing and breathing exercises, and then we finished off doing some pelvic floor work. I hope you found those useful. We really enjoyed doing this video for you.
It's been great.
If you have any other questions or any other topics that you want us to cover, just please make sure to comment in the video below. Obviously, it will help if you like and subscribe to the channel, but otherwise, we will see you next time. Bye, guys.
Bye-bye.